Circle for the opportunity. Also, thanks to you, Smriti Rastagi, for kind introduction. And before I start, I would like to salute the physician, nurses, and hospital staff of India who saved so many COVID patients at the risk of their own life. I know some 8,000 physicians lost their American experience, American healthcare, American medical education. And of course, it is up to India to take whatever advantages of the results of this experience, which I would entail. Number one, US experience with COVID. First case we saw in January 2020, the patient had traveled from Wuhan, China. In March, April, US affected by COVID and many people died and many people suffered. At that time, President Trump carried on press conferences every day, worked on ventilators, medicine, beds, etc., and vaccine. Extension of the ICU beds and additional hospitals were created in the stadium, in naval hospitals, etc. By December 2020, we had full vaccination available. And in January, we gave 1 million doses per day. In March, we gave 2 million doses per day. April and May, 3 million doses per day. June, 1 million. And now, of course, it is 500,000 per day. About 330 million shots, injections, vaccinations were given. And the death rate, as we saw, when we got over 600,000 deaths, mostly occurred in 85% occurred in 65 years and older with comorbidities mostly, and 5% below 50% of age, only 0.1% below 18 years of age. Right now, we have vaccinated 65 years and older, 78% fully vaccinated, and 88% one dose. So if you take the statistics of yesterday, in America, 33.7 million cases of COVID occurred with 606,000 deaths. While yesterday, new cases were 20,000 and deaths were 244,000. 55% of the US adults have got one dose, that is 130 million people, and almost 50% have got full vaccination, which is about 160 million. Now, 30% of the US adults are rather hesitant to take vaccination. Global infection rate is 86 million, while 4 million and 13,000 deaths occurred. So right now we are getting Delta variant in 52% of our cases, and Delta variant is seen in 85%, 85 different countries. So presently, we have vaccinated, as I've said, 50%, almost 50% fully vaccinated. In US and America and England, 50% adults are vaccinated. Now we're coming to the breakthrough infections and reinfection in the patients who got COVID, which is very rare. And of course, death rate is extremely minimal. So also breakthrough in which patients have taken vaccination. As you know, vaccination is good. American vaccination is good for 90% of cases when it is fully vaccinated. But if you take only one dose, then it is only 50%. Also, we do not know much about COVID long-term effect. For 1 year, we have seen patients still are lingering with fatigue, memory problem, cognitive problem, dyspnea, etc. And we do not know much about the vaccination. The vaccine, which we have seen, the blood clots, which is very rare. So also myocarditis is extremely rare, 1 per 12 million cases. Now in India, 1.4 billion population, and now 30 million patients have got infections, and 405,000 have died due to coronavirus disease. Yesterday, new cases were 43,000 and deaths were 910,000. Only 5% of Indians are fully vaccinated and 18% have got one dose. So in short, what I'm trying to say that India, the most important factor is, or treatment at present is the vaccination, and vaccination only. All you can say, the 8 months of American experience in the vaccination, even though we have got 52% Delta variant in 85 countries, still the American vaccines have stood up the time and the test of the protection and the efficacy. Now, the second point I wanted to talk about was in India and in America, the infection disease is treated rather differently. In America, we have 8,500 infectious disease specialists. An infectious disease specialty is there in vogue for 60 years. Now, these are the main people, main actors, main moderators, monitors of COVID treatment and prevention. Now, we are helped by epidemiologists, virologists, public health people, but most important thing is the infectious disease specialist. That is how we have a standard of care. Also in America, we have standard of hospital accreditation. All ICUs are same, all hospitals are same because they are accredited every 3 years. That may not be the case in India. So one has to be very careful in treating, because India, COVID is treated by various specialty and very variety of doctors. While in America, the standard of care, of course, it is changing on a daily basis, is all monitored or done by infectious disease specialty. Now, I would just divert a little to tell you our efforts of getting infectious disease specialty in India. In 2004, I told government of India that it will be better to get infectious disease specialty. At that time, of course, HIV and transplantation and other things came into the picture. And as you know, the septicemia rate, the death rate of septicemia is 50%. So what we said in 2006, I met with the Prime Minister, Health Minister, Health Secretary, Medical Council, President, etc., and took a delegation of infectious disease. 2008, the Medical Council passed that India should have ID specialty, but they did nothing till I followed it up till 2015. There were only 3 colleges, Vellore, Chandigarh, and Pondicherry. Right now, I'm told there are only 100 infectious disease trained specialists. So my point in telling all this thing is to have a leader in infectious disease hospital in form of infectious disease specialist. Otherwise, all the doctors may not be able to treat. And you have seen the black lung, as it was mentioned, the mucormycosis is extremely rare in America, even though diabetes is still common in America. But in India, 3,000 people died, 9,000 cases of black lung or mucormycosis. So what I'm trying to say that overuse of corticosteroids, not maintaining the blood sugars of or a blood glucose level of diabetics, that also makes a difference. And lastly, I would like to tell you about 100,000 doctors. Now, of course, right now, 75%, 75,000 doctors are like me, of Indian origin, the first generation. If you take my son Amit, then there's another 20,000, 15,000 in training. America is mecca of medicine. Experience of America can help India, and we, the doctors of Indian origin, are ready to help India. Even if 10% help, that becomes 10,000. So that is one factor which one has to consider for the better treatment, better medical education, and joint research as far as Indian physicians are concerned. Now, in summary, what I would like to say that looking at the American experience, India requires 10 million patients a day, persons a day for inoculation. 10 million, because we have 1.4 billion people. So in order to cover 1 billion, it will take 4 months. It is rather too late, but it is never too late to start. Second thing I would like to say that unvaccinated people are the formers of the variants. Now, because of the infection on vaccination, if you see in America, last month, that is June 2021, all the deaths were in unvaccinated people. Today, 90% of the American vaccines are protected against Delta virus, Delta variant. We do not know what will happen further, but at present, in England, the study came out which says that 99.99% of the children do not die of infection, COVID infection. So we have to learn from different experiences. India has 1.4 billion people, and India needs this very fast. For example, if you take Chinese or Sinovac vaccination, only 50% is protection against COVID, as against Pfizer, which is about 90%. So when India uses vaccination, the data or protection of the vaccination done in India should be parallel to that of America. So bottom line, all this I have told you is to start vaccination, vaccination, and vaccination. It should be almost 10 million people, 1 crore per day for 4 months. Otherwise, we will get more variants. Unvaccinated people form variants. Unvaccinated people get more infection. And of course, as you know, Delta is more contagious, more virulent, and more transmissible. So in short, what I would say that focus in my another interview and another Indian TV channel, I said, if you've got 100 rupees, 60 rupees should be spent on vaccination and 40 for treatment, that is oxygen, bed, remdesivir, etc. And it should be followed up very clearly from the guidelines which CDC of America which gives, and that will be helpful. Thank you.